This is an MS Neuro TV program provided by MS Views and News. My name is Stuart Schlossman, president and founder. I'm also an MS patient. We're always looking for new things to do, and we had this opportunity to bring up today's type of program that I really don't know what's going to happen, but you know, this very interesting thing on the market now. It's a biomarker for MS that's different than an MRI. So I want to hear about it. I know you all want to hear about it as well. So I spoke to the people from Octave and asked them if they wanted to do something, and of course, they said yes. So they assembled this panel. It's a great panel of presenters, and we have Dr. Megan Weigel, we have Dr. Mitzi Williams, and we have patient advocate Brittany Kiros and Mike Edgeworth. And to get this program started, I just want to do a quick bio on each of them. Dr. Williams is a board-certified neurologist and fellowship-trained multiple sclerosis specialist who served as the founder and CEO of Joy Life Wellness Group Multiple Sclerosis Center in Smyrna, Georgia. If you want to know more about her, you're going to have to contact Dr. Williams. Okay, next we have Dr. Megan Weigel, who's a nurse practitioner and MS certified nurse. She's the past president of the International Organization of Multiple Sclerosis Nurses, and she's got over 20 years practicing and with experience on multiple sclerosis. She's also an awesome yoga guru. I don't know what you call these. They're yogi masters and et cetera. And she's got her own program going on that as well as wellness programs and much more. Then we have patient advocate Brittany Kiros. And after her diagnosis of multiple sclerosis in 2019, Brittany created a hot mess. And to help challenge or help change the perception of what disability looks like. Her diagnosis was an answered prayer for her purpose and the catalyst for her calling to help others and impact a change. And then we have Mr. Mike Edgeworth. And Mr. Mike Edgeworth, MD and MS. Dr. Edgeworth is a neurologist and the Chief Population Health Officer at Octave, a company delivering an innovative precision care solution for patients with multiple sclerosis. Okay, I could go on and on and on about each of these people, but we really don't have the time for that. I want to get into hearing what they have to say. They are going to converse with each other. Afterwards, we're going to open up the floor to questions and answers.
Awesome. Stuart, thank you very much for the introduction. And thank you for trusting us, your webinar with this group for this discussion. I am really excited to be here. We do have an incredible panel. I hope we have a great discussion and conversation. I know we will. Again, as Stuart said, I'm Mike Edgeworth. I'm a neurologist and Chief Population Health Officer. I do want to give just a quick comment or two about Octave, which is maybe new to some of you. So tonight's conversation is going to focus on our biomarker, which we will get into a lot of detail on. So I won't talk about that as much, but I do want to just highlight that Octave is a precision care solution for MS, and it's not just a biomarker. We have also developed a solution for MRI and a clinical program as well. So our imaging solution and our clinical program both combine technology and human expertise for the imaging portion, really try and bring clarity to what we're seeing on the MRI. Both Dr. Weigel and Dr. Williams can testify that sometimes we get MRI reports that are, well, not very clear on what's happening. Is the MS worse? Is it stable? Have there been any new lesions since the last one? And so Octave set out to really clarify what we're seeing on MRI, and we do that by quantifying how many lesions, what's the total volume of lesions. So really bringing clarity to what doctors who are managing MS see on MRI to help them make more informed decisions. And then from the Clinical Insights program, again, which we won't go into tonight, also a combination of tech and human expertise. So our human experts are MS certified nurses combined with technology that we use to monitor patients, monitor medication adherence, monitor medication side effects, symptoms, possible signs of relapse, maybe pseudo-relapse, signs of silent urinary tract infections, things that we know that are common in MS patients. All of that is designed to bring new data to both patients and providers to help them manage MS better. That's Octave's entire goal. Tonight's focus, though, is on one element of our precision care solution, and that is our biomarker, what we call the MSDA or MS Disease Activity Test. So we're going to start, that may be the most you hear from me all night, because I really want you to hear from the panel, not me. But let's start with maybe Dr. Williams and then Dr. Weigel. Just what's a biomarker? Before we even get into what is Octave's biomarker, what is the biomarker?
Yeah, so that's an excellent question. A biomarker is basically a test, and they can take a variety of different forms, that tells us about the state of a disease, right? There are biomarkers that can be used to diagnose a disease. There are ones that can be used to tell us about progress of disease. For instance, with MS, the most common biomarker, which Stuart mentioned a little bit earlier, is an MRI. So MRI is what we use to diagnose the disease as well as to look at progression. However, what we realize in MS is that many of our biomarkers have limitations. So for instance, MRI can tell us a certain amount of information, but when people are having issues like progression or worsening, sometimes their MRIs will look the same. So we've always been on the search for these other additional tests that can tell us what's going on under the surface, so to speak, what's going on under the hood of the car. Is there inflammation that's going on, that people are reporting when their symptoms are different, but maybe we don't see it on the other tests that we have. So that's why the MSDA is a very exciting prospect. I don't know if you have anything to add to that, Megan.
Yeah, the only thing I have to add is that, as I'm sure, Brittany, I'm not sure if you feel this way. I'm sure Mitzi hears this just like I do, but a lot of people hate MRIs. And so, they're okay with their yearly MRI surveillance, but then if something's going on in their body that suggests a relapse and something that we're not quite sure about, maybe it's not really clear on exam that something's different, and we ask them to have an MRI in between their yearly surveillance, A, it can be really expensive, almost rate limiting expensive, and B, it can be really anxiety provoking. So having a blood biomarker that may help us make a decision about changing care is also really important.
Great.
And in addition to that, one of the biomarkers that we often use to help in diagnosis is a lumbar puncture. And nobody wants to get that more than once ever. So, so there are some tests that we really can only do once. There are some that are more practical to do once a year, but if there's something that, would be a minimal burden to people living with this disease that we could use to help us make decisions, certainly that's something that's very welcome from both the clinicians as well as the patients living with MS, I think.
Absolutely. Megan, to segue off of that, there is such a heightened level of anxiety for a lot of patients, myself included, when it comes time for those scheduled MRIs, whether it be every 6 months or annually. There is a heightened sense of stress that is put on the body. So being able to utilize a tool like what Octave has done with biomarker testing, it's allowing me as a patient to be more proactive and less stressful in doing so as well.
That's a great discussion on just biomarkers in general. Let's pivot then to the MSDA, the Octave biomarker test. What is it? Dr. Williams?
Yeah, you want me to take that, Dr. Williams, or do you want to take that?
It doesn't matter. So basically, kind of generally, the MSDA test is a combination of several biomarkers that have been studied for some time in the field of MS. One of the difficulties with science is that science in the lab can sometimes take a very, very long time to come to the community. So there are many tests that have been looked at, such as neurofilament light chain, which we call NFL, not National Football League, but NFL, neurofilament light chain. There are certain tests that have been looked at and studied that can tell us information about if there is inflammation going on within the central nervous system. However, because sometimes those results are not definitive, we haven't been able to use those in general practice. We only have those at our academic centers. centers where they're really doing the basic research. So this is really an opportunity to kind of jumpstart. And this test combines at least 15 different biomarkers. Some of those markers are associated with inflammation, right? Meaning maybe that person may be more likely to have a relapse. Also, there are some that are inversely correlated with inflammation. And so kind of looking at those tests and all the scores combined, there is a compilation of a disease activity score. And that score is on a scale from 0 to 10, 0 being very low inflammation, 10 being the highest inflammation that the test measures. And so we can kind of use that to gauge if someone has very inflammatory disease where they may be more likely to have, let's say, active lesions on their MRI, or if their MS is less inflammatory and maybe a little bit more well controlled.
Thank you. Megan or Brittany, did you want to make a comment on the MSDA, or I'll move on?
I think
just to piggyback on what Dr. Williams said, you know, we read papers a lot, right, in our medical journals, and the bench science, the under the microscope or in the petri dish science might say like, oh, well, this one protein is correlated with MS, but it's also correlated with a lot of other things. So each of these markers on their own, if we were to single them out, they don't have the same level of sensitivity and specificity and importance in MS as they do when they're measured all together in this MS disease activity test. Even neurofilament light, which when we first realized that it was important in MS and felt like the National Football League, right? And then as it was studied, we now realize, well, it's elevated in TBI, it's elevated after stroke, it's decreased if a person has diabetes. So there are all these things that can just change the interpretation of the weight of the test is what I'm trying to say. And the Octave test, by combining these all together, gives us it helps us use the proteins better.
I think it's also safe to say that there are a million question marks that come with a diagnosis of multiple sclerosis. There's a lot that cannot be seen. And again, MRI is going to show so much, but having a deeper, more analytical look at what's going on, that made me as a patient feel a million times more confident about my care management.
Brittany, that's a great segue to the next question, which is, how is the MSDA test different from current ways of monitoring, measuring, you know, your MS activity, your other patients with MS, their activity?
Yeah, so I think that Megan touched on this, you know, in her answer to the previous question. Number one, it's a blood test, right? Now we'll talk a little bit about whether it's used for diagnosis or not, but it's a blood test, and most of our other tests that we use to measure or monitor MS itself are not blood tests. So obviously it would be much more convenient than doing an MRI, let's say, or doing something like a spinal tap or a lumbar puncture. And also it is a combination of a variety of different proteins that can tell us about the biology of myelin. It can tell us about inflammation of the nerves. It can tell us about the integrity of the axons or nerve fibers. So it can give us a lot of different information about you know, neural inflammation and central nervous system function.
Great. Yeah, in fact, when we looked at the combination of, as you mentioned, Dr. Williams, the combination of the proteins that make up Octaves, our MS disease activity tests, when we look at that and compare it with individual biomarkers, individual protein biomarkers, even in blood tests, we do see that the combination, because of all of the information we get, outperforms individual biomarker tests. I'm not sure who mentioned it. Someone did, but someone mentioned, is this a diagnostic test? Is this a diagnostic test for MS? Dr. Weigel, we'll start with you.
Yeah, no, the answer is no, it is not a diagnostic test for MS. It's really a test to help us, you know, monitor the patient, and also perhaps, you know, I'm not certain that monitor the patient is the right word, because there's not like there's not a place to start except for your baseline, right? So the first time we do this test for a patient, we get a baseline score, and that score may be low, moderate, or high. If it's low, great. The next time we do it, if we're doing it at a regular interval versus if clinically indicated, we hope that score stays low. If it doesn't, if it's moderate or high, similarly, then we have to start looking other places to decide if there needs to be a change. So I think it's a piece of what helps us dictate the care of the patient over time. The other way is the same. If a score comes back moderate or high, then we want to see that whatever we change or do moves the score in the right direction, moves the inflammation and the myelin biology and the axon integrity in the right direction. So it's more of a tool for monitoring and measuring the state of a person's MS.
Right.
I think also there's a common misconception in the space in the community of multiple sclerosis that we are hoping that one day we will have a diagnostic blood test indicative of that diagnostic process, but I don't think that it's discredited in value at all. Aside from it not being necessarily a diagnostic test, there is so much value in being able to really dig a little bit deeper and look more carefully exactly what your specific blueprint as an MS patient is.
And then I'd also like to add, this is potentially an additional piece of the puzzle, right? So we are learning as we are using this. Obviously our goal with MS is to provide what we call personalized medicine, where we look at the individual in front of us and we say, based on these markers, based on your disease activity, we think this is the best plan for you. So as of right now, it is a great test that we'll talk about how we use in clinical practice and in real life. Right now, it doesn't have the ability to replace our MRIs. So even though we've talked about MRIs, we're not quite ready to stop doing our MRIs. But certainly as many tools in the toolkit and as many pieces in our arsenal that we can use to help monitor disease over time are extremely important, extremely valuable.
Yep, that's great. And you really made the segue for me, Dr. Williams, which really is, and Dr. Weigel, you've even mentioned this already, how you use it in your clinic, but what are the ways you use this test in your clinic?
So I use it on everybody, right? So everyone that comes in, so ideally, I am learning from my patient population. For those that I see a lot of newly diagnosed people with multiple sclerosis. So it's been very useful in monitoring those people at their baseline, determining their baseline before treatment, and then looking to see how that score may or may not change after treatment to, again, help assist with determining if we think that this is kind of the right way to go in terms of treatment. I use it on my patients who are established to see where they are, if their inflammation is down on their treatment. And then we monitor that over time, particularly if they're having issues. Let's say they're having symptoms they're concerned are a relapse. That's something that we can measure to give us additional information. Do we think there's more inflammation going on or not? And then for those who are switching therapy, so really I think it's a test that I use on anybody. So I've been using it pretty much in all of my patients, to first get a baseline and see where they are, and then to monitor over time to measure stability or, response to treatment, or just see how they're doing if they're having clinical symptoms of a relapse, but maybe their MRIs are the same.
Thank you.
Yeah, so I do the same thing. And I think too, with that, going back to the anxiety of MRIs, if a patient's having a relapse, this is something that can take the place of that. And so while you may be, say, checking this at a regular interval, say yearly for patients who are stable, oftentimes with folks who are newly diagnosed who have really highly active disease, we want to get another MRI 6 months after their therapy, right? Just to make sure there's nothing silent simmering underneath. And we could use this test to see where their disease activity was. The other place that I use it in my clinic is for people who are on highly effective therapies, but feel like they're getting worse.
Mm-hmm.
And I would not expect them to be the average person living with MS. I would not expect them to be getting worse on a highly effective therapy. And so if we do this test and their disease score comes back low, then I know that we need to work on symptom management. I know that we really need to dive deep into lifestyle changes to help them manage their symptoms and how they're feeling. We've mentioned this is not a test to assess progression. However, if a person is progressing, we can sometimes say that, well, you're on a highly effective therapy, your disease score is low, so perhaps what you're experiencing actually is the progression, that our disease-modifying therapies don't do the greatest job for forever at slowing down. So it's not a test to assess progression, but it can help us reframe what the patient's going through for them and help them manage their symptoms better.
I've also found it helpful in patients who are on what we call repopulation therapies, right? Where they may take a medication for a certain period of time, a year or 2 years, and then they may not take therapy for several years. And so again, they may be feeling well, but it may give us an indication that maybe there's some inflammation that seems to be going up or brewing, and that may also help us make decisions about whether to put them on another therapy after they finish their course of that therapy.
Yeah, and we've seen examples both ways too, where patients who have been off therapy for a couple of years and have the test drawn, some have still low levels and others are high and indicate, potential recurrent disease activity. So those are good discussions. You both mentioned baselining patients and then monitoring. What frequency do you use the test?
So for me, it would depend on how I'm baselining, like where I'm baselining the patient. Is it a new diagnosis? It would be great to get the test done before they start therapy. However, starting therapy is the goal, is the primary goal. So that can't always happen, in which case we get it as soon as we can, and then 6 to 12 months. So I think then with a person who's stable, once a year is a good plan, unless, it's otherwise clinically indicated. If it's a repopulation case, I would probably want to do it depending on the therapy, 6 to 12 months after stopping. Similarly with folks who are, say, getting their, I don't want to use an age, but there are a certain age of people who are coming to me saying, do I have to take my therapy forever? And so we go through this assessment to figure out whether or not it's the safest choice for them. And depending on the therapy that they stopped, I might choose to do this, say, 3 to 4 months after they stopped therapy. It just depends on what they were taking before.
Yeah, so my practice is very similar to Megan's, to Dr. Weigel's, and I probably don't do it any more frequently than a 6-month interval. So if we start a treatment, if they're pre-treatment and we start a treatment, I'm going to wait about 6 months. If I'm doing, since it is a relatively new test, I found that I've been doing it every 6 months in my patients just to get a feel for where their baseline is, because, I'm not sure if they may fluctuate a little bit up and down. So for pretty much everybody, I've been doing it every 6 months. And then once we kind of reach that steady state, then I will, go out to once a year.
Makes sense. This question is for everybody, but I'll start with Brittany on this one. And it's really, is something, new to the market, like this blood test to measure disease activity. What common questions, would a patient have? So if you, Brittany, what common questions would you have? And then for Drs. Weigel and Williams, what questions are you getting?
One of the first questions I had was price, how much this test actually cost. And I do know that Octave, we are actively working to have all health plans cover the solution. And there also is financial assistance programs that may reduce the cost to patients as well. So that was one of the first things that I was kind of curious about. Other than that, it was, where is this available and when is this available? And that's something that I'm continually hearing in the MS community, just from having programs educate like Octave or MS Views and News, is how do I get this from my doctor? How do I open up that narrative with my neurology team to make sure that this is something that is accessible to me as a patient?
Yeah, one of the other questions that I get is how often, the frequency. Do I have to fast? Is this test going to measure progression? Some of the things that we've already talked about are specific questions that I get. I think the cost, the program that Octave offers as a solution to the cost that's based on household size and income is a very generous program. And the cost of the test itself for the information it gives us is very reasonable.
Yeah, I would say the questions that people ask me are fairly similar. How much does it cost? How often will we have to do it? And essentially, what information does it tell us? But I find that once I start talking to patients about it, I find I'm doing more talking, and they're already like, "I'm sold. Don't worry about it. You don't have to say all the rest of that. I want to do it." And I'm like, "But wait, let me finish telling you about it." So people are often very excited about it.
That's great.
It's so exciting to have something new to offer people. I mean, it's just and to help just provide, as Brittany can testify to, no matter how stable you think your disease is, there is still that underlying anxiety of what if tomorrow ... And
Right.
So any more information that we can give that says, that can quiet that little birdie in your head is really valuable.
Yeah. Brittany, we get the question a lot too. Where can we get it? We obviously know doctors Weigel and Williams are using it, but what if, your MS doctor isn't using it? How do they get that? And we just would simply say if you're the patient, direct them to Octave's website, octavebio.com. There's a big green button at the top, get in touch, and we can certainly reach out. As we've rolled this out, we're in many clinics across the country, but we're not everywhere yet. So we can certainly speak to whoever's treating your MS. Those are the common questions that we hear as well. So thank you all for the answers. Dr. Williams, what value do you feel this test has brought to the MS community?
Yeah, so I think it's brought a great deal of value to the MS community. As I said, oftentimes when we're looking at different tests, biomarkers, we hear about them in the literature, we hear about them in the meetings, but you can only get them if you're at this select center where that person is the head of research, so it's been very exciting to be able to bring these things to the general population. I think the added value is that, again, it's an additional piece in our arsenal of trying to understand where that individual stands in terms of inflammation, and to help us to make treatment decisions. And so I think that it's very exciting. There's a lot, again, that we're still learning, but I think that we will learn things much more quickly when you have a larger population of people who are obtaining these tests, and we can compile these results much more quickly to learn, how to best use it in our clinical practice.
Dr. Weigel, anything?
I completely agree with what Dr. Williams said about, the sort of the academic level of testing, kind of similar to when a town gets its first 3 Tesla MRI. You just feel like you have access to something better for patients, and people feel empowered with more information. They also feel like, you don't necessarily have to wait for something bad to happen to get a test done. A lot of times with blood tests, we're doing blood tests because something bad is happening, right? So, you're dizzy, you're tired, we check your thyroid, your B vitamin levels, your iron levels, a blood count, those sorts of things. We're waiting for symptoms to dictate care. And with this test, while we can use it when symptoms arise, we're actually not waiting for symptoms to dictate care. We're wanting to provide patients with a baseline level of their disease activity. We want to follow it over time, and we want to make sure that we're doing the best that we can for them. There's some predictive value in it because just the way that the test works, the way the algorithm works, what it means. It means that there's a risk for disease activity, that being an MRI lesion within the next 60 days. So, a stable MRI is sometimes, we wonder what's going on underneath the surface. You mentioned, Dr. Edgeworth, about the MRI capability that Octave offers, and a stable MRI isn't necessarily stable under the surface. So again, just more information for patients, and it really, as a clinician, it makes me feel better about the service that I'm offering to people.
Yeah, one of the things that struck me with the biomarker is that when I manage patients with multiple sclerosis and I would put them on a new therapy, I was essentially waiting on a negative event to occur to know if that medication was working. I'm waiting on you to have a clinical relapse, or hopefully no clinical relapse, or I'm waiting on the MRI to show a new lesion. And so what I've heard is that this finally gives us some more objective information to see, like you're talking about baseline and then monitoring over time. Now we can actually see disease activity levels dropping, which you can't do with an MRI or a clinical exam. And so that's one of the things I've heard that's of great value to the MS community. Brittany, any thoughts there from additional value?
Of course, I think Dr. Weigel, you hit the nail on the head with patients want to feel empowered and confident. And there is a lot of insecurity. There's a lot of unknown. There's a lot of hidden corners in the space of living with something that is invisible. And there's a lot of question marks. So having more tools in my toolbox to be able to manage my disease, it only makes me feel confident. When I feel more confident about it, I feel more reassured of I can manage this. I know how to handle it. There's so much value.
Like that. So, Dr. Weigel, how are patients, how do they feel after they receive the results? Is it an easy conversation? Is it a complex conversation? How are they reacting to receiving results?
So it's pretty interesting because you get the sigh of relief when there's a good result, right? When there's a low result. And when there's a moderate or high result, there's actually also a sigh of relief, because much of the time folks, they just felt like something was off, right? And if we're giving them a piece of information that helps dictate change for better care and hopefully for better outcomes. So it just goes back to that empowerment piece. It's like, okay, all right, so what do we do? What do we do next? And thankfully we have 25 plus disease modifying therapies for MS. And so the vast majority of the time there is something to do next. And that makes that, it just, there's a plan. We've got a plan. We have an armamentarium, a pretty dangerous one. And when I say that, I don't mean dangerous. I mean, yeah, we can attack this disease, dangerous. We also have great, I should say, emerging evidence about lifestyle changes and the impact that they have on the immune system in MS. So we really, when there's a score that's not what we expected or wanted, we have a way to help, and we have a way to make a change and improve lives.
Great point. Even if monitor or high, it can be affirming what they're feeling, what patients are feeling or sensing or know that's going on. That's a really interesting answer. Dr. Williams?
Yes, I would say similar. When the scores are low, people are very excited, particularly when they are stable and doing well. It's that additional reassurance. And when the scores are high, again, it gives us another piece of information to help us make decisions. So I haven't had necessarily a lot of people that have, let's say, gotten depressed or anything like that with their tests. It really is kind of building a determination, to say, okay, well, what's the next step? Or what do we need to do, or how can we continue to combat the MS? So overall, the results or the responses have been very positive when people have received their results.
Brittany, you're the patient. We shouldn't be asking ourselves what do patients feel. We should just ask you, how do you feel?
Oh gosh, me personally, and I think it's safe to say this would be a unanimous feeling in the community, is we want answers, regardless if they're good, if they're bad, if they're not so great, if they're getting better. We want reassurance and validation that we know what is happening inside here. Because when we hear the words, you have MS, and you're now one of the 2.8 million people living worldwide that have multiple sclerosis, it is just this giant question mark. So having any sort of substantiated, concrete backing to where we are, that's absolutely so valuable. As somebody myself living with MS, so much value.
Thank you.
The only thing I would add is that sometimes there is, I won't say people get upset, but sometimes there's a little bit of a question when someone gets a score that's just smack dab in the middle, right? So they're like a 5, and it's like, well, what do you do with that? Because you're not low, you're not high, and the way that I usually explain that is that, again, this is very individualized. This is your baseline. We will monitor that over time. But I have had a couple that have just been like right in the middle, and it's like, I'm not high, I'm not low, what am I? And so again, we have to monitor people over time to kind of see where they fall.
Maybe we should quantify, Dr. Williams and Dr. Edgeworth, like what that means. So a moderate score means that you're 4.5 times more likely to have a new MRI lesion in the next 60 days than a low score. A high score means you're 21 times more likely to have a new MRI lesion in the next 60 days. Did I say that right, Dr. Edgeworth?
That's right.
Yeah. So there's a large variation between moderate, or there's a large, that's not the right word, but you know what I'm saying. There's a lot of room between moderate and high.
Absolutely.
And to state it again, Dr. Williams said this, I think, earlier, the score, just for everyone's sake, the score it ranges from 1 to 10. Low is 1 to 4. Moderate is 4.5 to 7, and then high is 7.5 to 10. And that's where we get those categories from. And Dr. Weibel, that's exactly right. That's how we think about that. The other thing that, Mitzi, we've seen is when it comes back at a 5 and the patient's been on therapy, the question is, what was it before they started that therapy? Because we don't always have, if it's new to your clinic, you're not going to have a baseline from a year ago.
Exactly. And I have had some people that have started at a 10. So 5 would be a great improvement from a 9 or a 10. So, it's just counseling, counseling people, but yeah, it's, overwhelmingly the response has been positive. I would agree with Dr. Weigel and also with Brittany.
So my next question is twofold. It's what do you like most about the test? But I also want to have some transparency here. There's no such thing as any perfect test, right? It's like we've said, it's not replacing anything, it's just adding more insights. So are there limitations to Octave's MSDA? So what do you like most, and then what are the limitations of it? We'll start with Dr. Williams.
Okay. So, what do I like? I like that it's convenient. I like that it's a blood test, that people can get, and that it's relatively easy for them. I think I also like the breadth of the information, right? So, not only are the patients learning, but I'm also learning, about how these biomarkers behave in the patient population and what they mean to that specific individual, and so I think that piece is very exciting. The patients are very excited about the science, as well as I am as a clinician. I would say things that may be potential limitations are availability, right? Even though it's available in my clinic. I have a very small clinic and I don't have a phlebotomist every day. So I can't send them to a lab near their home, across town to get the test. They have to come back to me to get the test. So that's a potential limitation. But again, most people are willing to come back to the office to get the test done. Even if they can't get it at, a larger lab. And then again, I would say in terms of limitations, we're still learning, so there's not like a specific score where we can say this is a horrible score, right? It gives us information about, the likelihood of inflammation. But again, if a person started at a 10 and they're at a 7, that's great progress, right? But oftentimes we don't know where someone started because they may already be on therapy. So those are a couple things, but as I said, by and large, is very exciting about the science, and my patients are very excited about it too.
Dr. Weichel?
Yeah, well, I echo all of that. I think that it's exciting to know from our colleagues that folks like Dr. Williams and I, who are in smaller practices but MS-focused practices, are using the test. It's exciting to know that folks at larger academic centers are using the test, and we're all equally as curious about it. Different providers are looking at the test and studying it in their own way. We're all learning together. I like that it's convenient. I like that it's a blood test. I love the Octave promise with the cost of the test. And I would say my only issue is access. We don't draw labs in my office. People go to any lab test now in our area. And fortunately, we have several of those around that are convenient, but we also have folks that come from far, and there aren't places for them to be drawn where they live. And you guys are working on that at Octave. I mean, access is a big deal. So with that being said, my hope would be that this is something that general neurologists who are treating MS would be comfortable ordering, and maybe consulting with specialists like Dr. Williams and I about the results to increase access for patients. But I feel that the benefits far outweigh the limitations for me, and I hope that translates to larger academic centers that may not yet have the confidence in the test as we increase the use of it.
Great. Brittany?
Oh my goodness. I will tell you what, as the hot MS that I am, when I was diagnosed, I wish that this was available. I felt uneasy. It was an emotional whiplash of a situation, to say the least. And again, multiple sclerosis leaves us with a continual flood of what ifs, question marks, and this overwhelming caution towards what our future will look like. So I think it's safe to say that we will welcome anything and everything that gives us a better understanding of where we are with our disease. We want to have that upper hand. And while MRIs and office consultations, treatment, lab work, these are all vital tools that we utilize to have a better handle on the management of MS. These protocols within the care and management of MS will always continue to open doors for us. Right, and the aspects of treatment, slowing progression, reducing relapses, and most importantly, I think planning for our future. So open doors provide opportunity to be proactive, more hands-on with our medical team. So open doors, I think, are a must for people living worldwide with MS, and Octave's precision care solution, especially with this new disease activity test, has provided us with an opportunity to not only stand in front of the open door, but to also walk inside and have a deeper view at our current reality. I think that's something that we have not yet had until now in the space of multiple sclerosis.
Great, thank you. I think we're going to squeeze in one last question, and then we're going to open it up to the audience for Q&A. But the last question, I'll start with the physicians, and then I'm going to end with Brittany. Has this test had an impact in your clinical practice? Pretty straightforward question. Has it had an impact in your clinical practice? We'll start with Dr. White.
Absolutely. For all the reasons we've already mentioned, and I would say that while initially there was some concern about workflow, something else to get through in a clinic visit, that has not been a problem at all. Mm-hmm. And accessing the results of the test has not been a problem at all. This has, and just from the standpoint of of a clinician. Like, you know, I think Dr. Williams, you're the nerdy neurologist, right? Yeah. So like, oh my God, we have something new. Like you walk in the door, hey, I can't wait to tell you about this. We have this new thing. And so, yes, it's made a difference.
Yeah, so I would echo those sentiments. I think it has made a difference. I can think clearly of several examples where we have adjusted treatment regimens or had different discussions about treatment based on the results of the test. So I think that's very exciting, that it can inform clinical practice. And like I said, my eyes light up when I'm talking to patients about it, and I'm just trying to get all the information about it. They're like, I'm good, I want to do it. And I'm like, but wait, you know, so I think that it is definitely exciting, and to be able to advance the science, you know, in the general population is an amazing prospect.
Awesome. And Brittany, what about you? What impact in your daily life does this have?
Oh gosh, I very much like answers in life. I get very, very unsettled if I don't know all of the moving parts. So when this was brought to my attention by my neurology team and his assistants, it was absolutely, I listened, I think, to about 12 seconds of what it was before I had already said yes. Because it creates an opportunity. It provides an opportunity for us to really look at a wider lens, look at a bigger picture, and be more proactive about our disease. And me, I'm very active. I'm a busy bee. So if I know exactly what is going on and I'm able to really approach it more directly, I can make other adjustments in my life, say with physical activity or with diet and exercise. You know, there's so much room, I think, for opportunity. And I know that that is something that most people living with MS, we want to have a better handle on. Me, I run my health like a business. I am the CEO of this disaster. So, you know, the more hands on deck, the more tools I have in my toolbox, the better I'm able to manage and care for my disease.
Awesome. Well, Brittany, Dr. Weigel, Dr. Williams, what an honor for me to sit on this panel with you and help kind of with the Q&A. It's been an honor. Thank you so much for your time and your insights. And Stuart, you're back on, so I think we're going to open it up.
Oh my gosh, you guys did such a phenomenal job, and yet still we are going to be here for a long time answering questions. There are a lot of questions. I hope you all don't have to run to the restroom, but you might have to. I've got so many screens open about all the different questions that I can't even see faces on my screen anymore. Okay, so one of the first off, I want to thank you all for doing this, all right? I mean, thumbs up all across the board. I am so appreciative for Octave putting this together, that it's definitely of need for people to know, and I don't see how people have questions with all that you've spoken about, but I think that some of it might be repetitive, and I'm sorry if it is, but this is, you know, the MS community. We can't all remember everything, and I'm sure there are a lot of new questions as well. So let me get started. And Mike, I'm just going to have to leave it up to you to distribute who's going to answer what. So the first thing, you guys kept drilling about cost, all right? Cost. I didn't actually hear, though, what the actual cost is for starters. And, you know, if a person doesn't have insurance at all, they're not covered by anything. I know that Octave might pick up on it, or will they not pick up on it if they don't have any insurance? And to take that a step further, so we could answer more than one question, if they're on a government insurance, will Octave cover the cost of the test?
I'm going to take that because I assume no one else wants to take that on the panel, since that's really a question for me. So Stuart, it really is a great question. Probably the best way to answer that is that most patients out of pocket are going to spend somewhere between $2 and $149 for the test. And that's dependent on, as Dr. Weigel mentioned, family income, family status, number of family members. So a lot of variables that go in that. We are actively, as she mentioned, working on contracts with health plans across the country to cover the solution. So it's always difficult to give a specific answer because health plan benefits dictate co-pays and deductibles, and so out of pocket is where we're oftentimes a little bit in the dark. So we say that most are going to spend somewhere between $2 and $149 out of pocket for the blood test.
Okay, thank you for that. All right, next, continuing on the financial aspect, when would a person file for the financial aid possibly in order to have the test done?
Yeah, probably one of the best things to do there is even at the beginning, just go ahead and contact Octave, and we can do that. Either the physician ordering can help you with contact to Octave, or you can do that directly on the website for assistance with understanding where you might fit in that scheme of things in terms of the financial assistance.
Okay, thank you for that. All right, next we have a person asking, does the Octave panel help to identify progression in PIRA, not active secondary MS?
Yeah, so that's an excellent question. Currently the test does not measure progression. Essentially what we're looking at is inflammation and the likelihood that someone will have active disease on MRI. So it's not a diagnostic test, and it does not currently recommend assess progression. And PIRA is progression independent of relapse activity, for those who may not know what that term means. And so when we think about progression, there's progression that can occur associated with a relapse, meaning you have a relapse, and then let's say you have some weakness and it doesn't get completely better. So your disease has progressed since before the relapse. And then there is progression that happens independent of relapses, meaning you didn't have a relapse, you had a little bit of weakness, and now over 6 months, over a year, you notice that symptom is worse, even though you haven't had an acute episode.
Thank you. And so I'm going to say, going forward with what you just answered, can the test determine if a person will go from relapse remitting to secondary progressive?
It cannot.
Right.
Okay. All right. Thank you for that. All right. Next. Let's see. Again, so many. I'm just trying to stay in some kind of format, but it's not really working when there's so many in front of me.
Well,
what about
for that next question, Stuart? That's exactly right. The test is not there designed to look for advancing from relapse remitting to secondary progressive or PIRA. It is an area we are actively exploring, but the test that we have out now is specific for just measuring current disease activity levels, not progression.
Okay, so how does this work for a person that has primary progressive MS? And before you answer that, I want to let everybody know I'm not mentioning first names with tonight's program. So if you have questions, just ask them, and I'm not even saying a first name. There's a lot of strange names here. That's why I'm saying that.
Dr. Williams, Dr. Weigel, do you want to?
Yeah, I mean, I would say that I would answer the same way for a person who has progressive MS and is concerned about their worsening of disease. And so let's say that a person is on the one therapy, the one disease modifying therapy that's approved for primary progressive MS, or let's say a person is on any therapy for secondary progressive MS, and their disease their disability level, whether it be cognitive or mobility, has gotten worse over time, over 6 to 12 months. Their MRIs are stable, and they say, well, my therapy, it's not working for me anymore. So if we were to get this test as a piece of information and their disease activity score were to be low or were to be lower than it was prior, I would have some information to say with them, this test is not measuring progression of your disease, but what it is telling me is that what's happening in your body right now is not related to active inflammation. It's related to other processes that our current disease modifying therapies don't do the best at treating. They do great at decreasing number of MRI lesions. They do great at decreasing relapses. They do well. Some do well at keeping disease stable, disability level stable. Some do well in a small percentage of people at confirmed disability improvement. So what we're dealing with is disease progression, and we need to help you with your symptoms. So that's how I would answer that question. It was a long-winded answer, but that's how it would work in a person with progressive disease who wants to know if the test would be right for them.
And I think another piece is that there's a lot that we don't understand about inflammation. So in all of our conferences now, there are these conversations about smoldering inflammation, right? Where even though someone may present primarily as having progression, there still may be some inflammation going on under the surface. So I wouldn't necessarily discount it and say that a person who has progressive disease could not benefit from the test. Certainly in the case that Dr. Weigel suggested, it can help us rule out inflammation, but also could help us to learn more about the inflammatory process, even with those who primarily have progression going on clinically.
Okay, thank you. So next we have, how long does it take to get results once this test is taken?
About 7 days. Yeah.
7 days. Okay, thank you. All right, next, this blood test, is this a finger test? Is this a arm test? Where are they getting the blood from?
Oh, we got to get a vein now. No finger sticks now. If we're going to stick you, we got to stick you. So, essentially it would be the same type of blood draw if you were getting like your white blood count or vitamin D level. So it's not a finger stick, but it's a regular blood draw.
Yep, exactly.
But it is just one vial. So it's not, you have to get a bunch of blood for that test. It would just be one tube or one vial.
God, am I glad to hear that. Oh my gosh, you go to Quest, they take everything, right?
Like a vampire.
I'm telling you. I have to go in there with a container of orange juice all the time.
In fact, the amount of blood that's required is really small, but we do collect a single tube of blood for the test.
Okay, thank you for that. Next, is it available everywhere, or does a provider have to send the sample to a specific lab?
Yeah, great question. So we are working on getting this available across the country. It's already in over 30 clinics, MS clinics across the country now. And if it's not there today, all you got to do is simply ask your doctor to reach out to us, and we'll work with them on figuring out, is that something we can have someone in their office draw, or do we need to work with a local lab company to do the blood draw and send it to Octave for processing?
Okay, great. All right, next. Oh, so that brings up another point. You know that, I don't know if you know, Dr. Edgeworth, but we do a tremendous amount of programs in rural America. Mm-hmm. How is the word getting out to people in rural America that do not have the internet?
How is the word of Octave's test getting out that don't have access to the internet? That is a great question. It's largely, I would say largely, we do our connection primarily outreach to providers. And so we're not necessarily that big on marketing directly to MS patients as much as we are to the providers, because our test requires a provider's prescription to be ordered and drawn. And so our outreach is primarily to those taking care of patients with MS. If patients with MS hear about it first, then they can go to their doctor, who certainly would have internet access, and look us up.
So in rural, thank you for that answer, but in rural America, generally, in many of the regions that we have traveled, the patients know more of what's available than the doctors know of what's available, mainly because there are not MS neurologists in these rural regions. There are neurologists that are handling everything under the sun about somebody having to deal with some condition that's neurologic. And they don't have time to learn about everything new that's come out. And so they don't. I mean, they have to have time for themselves, for their family, and et cetera. So it's the patients that need to bring this information to the doctors. So again, how will Octave make sure that the information is reaching those in rural America?
Yeah, it's really a great point, because we also know that it's not just unique to MS. It's the case for other neurodegenerative diseases like Parkinson's, where we know that patients with that specific condition are the minority of patients are actually seeing specialists in that field. I think what we see is about 25% of patients with MS actually see an MS trained neurologist. About 10% of patients with Parkinson's see a movement disorder specialist. And so your point is a great point. How are we getting messaging out there? I still believe that a lot of it is going to be marketing to the general neurologist. And here's why. Stuart. There are never going to be enough MS specialists to take care of all the MS patients in America. There are never going to be enough movement disorder neurologists to take care of all the Parkinson's patients in America. We need to begin to educate them. And I said this from the beginning. My specialty training is neuro-oncology. It wasn't MS. And so after I left academic medicine, I went into a general neurology practice, and I care for patients with Parkinson's and epilepsy and MS. This tool, had I been educated on this tool, would have radically transformed my ability to care for patients with MS, above and beyond, what I was ever able to do before. So we still have, what we talk about is Octave solution raises the ability of general neurologists to provide excellent care to MS patients who don't have access to an MS specialist, and that's the goal we have. So we'll continue to work on marketing in the rural areas, but our primary focus is let's make sure that doctors know the tools are out there too.
Thank you. And sorry, but I do have to go a step further with this. So there are great MS doctors that are handling big rural regions around the U.S. They're in Alabama, they're in Mississippi, they're in the Dakotas, and et cetera. But they're handling thousands of MS patients that don't get to know of something like this that's available for them. So my question again goes back to, how will the patients learn of this if they're not getting in to see their doctor, because they're saying, well, there's nothing that can be done for me. I've been told about this so many times already. The doctor says, I wish I could do something for you, but I can't. And they really don't speculate on what can be for them for the future. So again, they've fallen into a crack, okay? And we have to get the word out to them all about how they're going to learn what's better for them. Dr. Williams, can you answer that?
So, go ahead.
Oh, there you go.
Well, I don't know that I can answer that for Octave particularly. I think that, of course, platforms like yours, Stuart, programs like this that raise awareness about new things are extremely important. I wish that I could go to every city and touch every person, but, I got kids to feed and, see every once in a while. So I can't do that. And neither can Megan and neither can Brittany. So I think that it's important to partner with organizations like yours, like MS Views and News, to get the word out, particularly because you guys have a passion and a heart for working in the rural community. So I think that partnerships like this are important, and that's how we'll raise awareness and get the word out, is by working with grassroots organizations.
Absolutely. I think that there is a lot of patients, myself included, that are infectiously advocating for the disease of multiple sclerosis as well. So I would love to see some sort of liaison program between Octave and patient advocates in these rural areas as well, that is using their passion with their advocacy to have outreach as well.
That's correct.
Yeah, Dr. Williams, sorry, go ahead.
You can speak. I'm not going to stop you.
So I think those are all great points, and we are actively working with patient advocacy groups like yours, working with Brittany, but also national societies like NMSS and MSDA. I think those are going to be great resources that patients will go to far more regularly than their providers will. And so that's going to be another avenue that Octave is already in partnership with entities like that.
Great. Thank you for that. Brittany, question directly for you. How are you engaging patients online about this test, and where are you making these announcements?
Anywhere and everywhere I can. Social media, Facebook, Instagram, my website, YouTube. I often will post in my stories as well. And then if somebody does DM me directly, I always send them a personalized message back. I'll even jump on a call if somebody's unsure of how to have that narrative with their doctor. I'm not sure. I'm a little uneasy. I don't know how to, manage my health like a business. I'll get on and have just a normal conversation of saying, hey, write your questions down, go in with a list of questions, make sure that you have all of your questions answered within that appointment. And if they're saying, well, we haven't heard of it or we're not knowledgeable of it yet, pass along Octave's information directly to your neurology team so they can contact them and get that ball rolling. But any way that I can get this information out there is, if I could send a carrier pigeon, I would.
Thank you for that. All right, next general question from whoever. What about the false positives? Other neurologic conditions can also cause high markers. How would that affect the MS? I don't know what he got.
MSDA.
MS. Yeah. So would it let physicians escalate DMT based on false negatives?
So I think I can take that a little bit, Dr. Edgeworth, and then you can take it. So one of the benefits of the test is that these 18 proteins in and of themselves are specific to inflammation and some other things in the central nervous system that we've talked about, or they're specific to the central nervous system. They're sensitive to these other types of information. So each one on their own would probably have, false negatives and false positives, risk factors, what we call confounding factors. So a person with obesity has a different score than a person without it, a person with a history of stroke, et cetera, et cetera. But when we put them all together, we get better sensitivity and specificity. And so, yes, there are certainly conditions that could alter the level of the test. For example, I had a patient who had a trigeminal nerve rhizotomy. So he had a severed trigeminal nerve on purpose, really bad facial pain. The week before, he went and did the MS disease activity test, and his score was high. Well, he had a severed cranial nerve. So there are things that can alter the effects of the test. But I hope I gave a little bit of an answer to that. That it's not, this test isn't offering a positive or negative. It's offering a value on a disease spectrum.
Thank you. Megan, following up on that, you spoke about something earlier, I believe, that you made mention of it, that leads to this next question. Can the blood test determine if a patient really does not have MS? Maybe something else, like...
No. That's just a no.
Okay.
Yeah.
Okay, then we'll go with that. All right, and next question is, what if an MRI does not match what the blood test reads?
Right. So again, this is an additional piece of information, right? We talked a little bit earlier about, how MRIs only show us a certain level of detail. There are points at which someone may have symptoms of relapse that we're concerned about, but their MRI may look the same, or they may have changes in their disease and their function, but their MRI looks the same. So this is additional information to help us make those clinical decisions. So we would expect in some cases for someone, to have issues and to potentially have the same MRI. However, if the score is high, it does tell us the likelihood that that person would have an additional active lesion on their MRI. So, again, it's an additional piece of information to help us. But it doesn't mean that if the MRI looks the same or there's not a correlation that we would disregard the test.
Okay, thank you for that. Person wants me to ask Brittany a question. Have you found that that biomarker testing helps you understand what is happening in your body, and does it help validate how you're feeling?
Absolutely. Validation for me is a big indicator of what changes that I need to make and be more proactive about. I found out that in particular, my demyelination was a little bit higher than I had hoped. So I'm making a few changes that I need to as far as inflammation and reducing inflammation. But again, for me, it was having more answers, because 99% of what I deal with in particular is unseen and invisible. So it was validating and reassuring. Absolutely.
Thank you. And what does this test do to help determine if somebody's offspring might get MS?
Nothing.
Okay.
Yeah.
That
There's
answers
no test
that.
for that.
Stuart, there was one question we may have not addressed, which is this a genetic test? We sometimes get that. And the simple answer, obviously, is no, this is not a genetic test. And genetic test is what we oftentimes look at to understand risk of passing a condition along to our children.
Okay. So for both doctors, what is happening with a patient that would make you want to use the test?
So I would use it on anybody, right? So again, when we first do the test, this test is very individualized. So, again, even though there are categories of low, moderate disease activity and high disease activity, someone could have moderate disease activity, but it could be really an improvement from where they started if their scores are very high. So I think that there's a potential to use this on anyone, initially as a baseline to see where we are, to monitor inflammation over time, to look at those cases where people may, let's say, have symptoms that may be concerning for relapse. We don't necessarily want to do an MRI at that point, to give us additional information for those that are switching therapy. So I think there are a lot of uses for it for basically anyone who has MS.
Okay, so therefore then, it doesn't show the old damage, but it only shows what damage then is happening since from when you start as a baseline, correct?
Say that one more time, Stuart. I want to make sure I understand.
So are you starting with a baseline somewhere on how do you regulate? How do you start with a baseline? How do you start by saying this is what the patient has, and then you're going to use it on a patient in X amount of time to see if they're actually going to worsen or have already worsened?
Right. So the baseline will be different depending on where someone is in their course of disease, right? If I catch someone newly diagnosed, I will try to get the test when they're first diagnosed and then get it after they start treatment to kind of see how that treatment may or may not be decreasing inflammation. For someone, let's say, who's very established on treatment and they're stable, we get a baseline to see, okay, this is what stable looks like for that person. And then when we repeat it, we'll see if that's going up or down, depending on if they're having symptoms. So, so again, it can't tell us, where we start just depends on where that person is in their journey that they're in. Hopefully that answers, and maybe you want Mike.
One of the things we know is MS patients are unique. Not every MS patient is unique, and we know that there's a wide range of severity of MS within our patient population, and so not everyone has a starting point of 10 and you work down. Some may have a starting point of 5.5 or 6.5, and you work your way down with therapy or treatment.
Right. So with these tests, then, are you determining that what kind of medication a person should be getting going forward, so that way you can keep them from worsening?
So it doesn't so it doesn't necessarily tell us which therapy they should do. Now, there are many in the scientific community that are looking for biomarkers to tell us which therapy someone will respond to. That's not the purpose of this test. What it can tell us is that after someone starts whatever therapy we decide is the best one in combination with shared decision making with them, if that inflammation is going down after they start that therapy or switch to that therapy. But it doesn't tell us which one would be the best one.
But if you see that there's going to be a percentage chance of that person having lesions in the near to short distance future, you're going to want to suggest that they come off their current therapy and get onto a newer therapy to help prevent that from happening?
That would definitely spark a conversation about it. Definitely spark a conversation.
And Stuart, as you know, there are also prognostic factors we look at in MS patients to help us maybe pick an initial therapy for a newly diagnosed patient. We don't look at the MSDA as being, as Dr. Williams mentioned, predictive of response to a specific drug. It may add to your tool set of prognostic indicators to know, should we start moderate, high efficacy, certain type of therapy, but not in terms of a prediction of response.
Okay, thank you for that. Sorry, I had to get offline here and start grilling you all. So it was just my own mind getting into it.
You're good.
Great questions, Stuart. You always make us think.
Yeah, a little bit. All right. Next person, thank you, is asking, I had told Neuros I wanted full MRI without contrast, but they ended up doing just the brain and the C-spine. I don't understand where this is going, but maybe one of you do. I had told neuros I wanted full MRI with and without contrast, but they ended up just doing the brain and C-spine. So how are you finding that? I think maybe they're looking to see what else might be happening lower down in their spine.
I'll go ahead, Dr. Weigel.
Well, I was just going to say that doesn't quite relate to the topic of tonight's conversation, but yes, when we're doing a full evaluation of the central nervous system as it relates to MS, it is nice to have a thoracic spine MRI in there. And I will say that not everyone has that done.
Right.
Thank you.
We have talked about, the fact that the MSDA is a blood test. It's going to check for, these proteins in the blood. It's not looking at blood from the thoracic spine or lumbar spine or cervical spine or, some part of the brain. It's looking everywhere. And so if we do think that there's a little bit of advantage there if you're typically just getting brain MRIs or brain and C-spine, but you're missing the rest of the spinal cord. The blood test is going to, it's a blood test. It's getting blood from everywhere.
All right.
All right,
point. Great. Thank you for that. Now, I first off, everybody that's out there, if your question is not relative to tonight's, like that one caught me off guard, all right? But I am just going to tell you it's not relative, and I'm going to delete your question out, not you out. But there is a good question here, and this is something that we haven't thought about all night, is that we're talking about the cost in the United States. Is this product available outside the USA? That's the first question. And secondly,
not today.
Okay, because I got people online here from Canada, and they're asking about this. So they were asking if it's available in Canada, and if so, what are the costs there, and et cetera. So you just answered that, though, so we could delete out all these. Boom, boom. Now we got less to ask. All right. Can the test detect where the inflammation is actually located?
Again, for a similar answer to the MRI question, is the blood is coming from, it's systemic, right? It's a blood draw, so it's coming from everywhere. So it's not able to determine where activity may be occurring. That's where MRI is so powerful.
Okay, thank you for that. It's hard to go through a lot of these questions because I write novels, so it's hard to read them all and then pay attention to what you're saying at the same time.
You're doing a great job, Stuart.
You're doing great.
You're a moderator extraordinaire.
All right, question. You're saying about that the MS doctors around the United States know about this. Is this now available at all functioning MS centers around the United States?
No, not yet. We are actively pursuing, every MS clinic out there, but it takes some time. So we're in well over 30 big MS clinics across the country, from coast to coast. And so if we're not in your MS clinic, whoever's asking the question, just again hop on our website, octavebio.com, put in a note or have your doctor put in a request for outreach.
Okay, thank you. So how would people know where or what centers have it? Okay, for instance, let's talk about rural America again. Why would a person travel the 2.5 hours to get to their doctor if it really isn't available there, but yet their doctor says, come on in? So how do they really find it? Is there a list somewhere of which MS centers? Yes, that's my question.
Yeah. I'm going because I'm not a marketing guru, Stuart. I'm gonna punt that to our marketing team, and they're more than happy, seriously, to answer this question. So the email is pretty simple. It's marketing@octavebio.com. So if you want to put that out there, it's a great question. They will know exactly where we are, all the clinics across the country, and can answer that. If there's a specific question, are you in my clinic? They can do that.
Great, thank you. I think some of your marketing people are online, so I'm letting you all know I need a list. I need a list because I need to. I need a list because I need to. I need a list because I need to publish it, guys. All right. So get it over to me, and we can take care of this question.
And
And
Mike,
it may be helpful.
go ahead, Dr. Williams.
Well, I was going to say it may be helpful before you make that drive to just give your doctor's office a call and see if they're running the test. You know, the whatever MS clinic someone follows with, you know, they can call and see if they're actually doing the test. But you know, certainly that list, I don't know about the list. That would be very helpful.
But certainly also a lot of times people call their doctor's office and they're only told, come on in and let us check you out.
Got it.
Right?
Understood.
Right. And to make that kind of drive when you're coming, you know, driving 2-3 hours to go see your doctor is an issue if it's what you're expecting to be there isn't really there. So we have to stand up for those people too. Absolutely. All right,
Brittany,
next.
I think Brittany had something.
I was going to ask Mike, what does the future look like for Octave's involvement outside of the U.S. for our neighbors in Canada and even UK?
Yeah, I know it's something that's actively being explored. We're certainly interested in getting this not just to patients with MS in the United States, but elsewhere. I don't know a timeline at the moment of when that will look like and where, but I know it's something we actively talk about.
And let me just say too, Stuart, with you know, the clinics that have the test, clinics that are adapting the test, I don't know how many MS centers there are in the country, but as Dr. Edgeworth said, there are 30 using the test, right? And I feel like we're early adapters. And we were presented, Dr. Sanders and I were presented with the information in like August or September of last year. And we didn't order our first test until May because we had to sit down, find the time outside of the clinic because we're too busy in the clinic to talk to each other about other things. We had to find the time to sit down, figure out how it was going to work in our workflow, create a system with our staff that worked for us so that we didn't get behind because we don't want to keep patients there forever. And then finally by like the second or third meeting, I was like, all right, I'm doing it today. I don't care what's happening, right? So it's not this adapting new things that are not just, you know, a click on the computer takes time for clinics. So please be patient with your providers as well, because we want to make sure that we're doing things the right way for you.
Yeah, and we now have a full team that partners with new clinics, you know, beginning to utilize the blood test to help them speed up that process, Megan. So that's been great feedback.
So what do you do for, I mean, there's a lot of doctors out there that just don't want to know from anything until it's out, until whatever is out there for a couple of years. And this goes back to even the days of Tysabri coming out, okay? There are doctors that just said, there's no way I'm putting my patient on this until I see how well it works. How are you convincing these doctors that this is really beneficial for their patients?
So I'll say one thing. I live in an area where there's a large academic center that will remain nameless. I share patients with that center. They come to see me, you know, regularly, and they go to that center once a year. And we're sharing notes. And in my notes, I simply say that I consider the risk of a test like this. Well, okay, it's a blood test, so ouch, it hurts when you get a little blood drawn. But I also think about risk as like psychological risk to a patient and financial risk to a patient. And you've heard Dr. Williams and I talk about the psychological risk to a patient from this test basically being almost nothing. Even with bad results, patients see it as, okay, this is an action item. We're going to put this into action. We're going to do something for my MS. So the psychological risk is low. The financial risk is very low. So I see no downside to this test. And I actually write that in my notes that I share with centers who aren't yet using it.
And
I think is also applicable to the communication that the patient has with their doctor as well, that they can be knowledgeable of the availability of this and bring that and have the confidence to have that conversation with their neurologist and say, hey, I want to advocate for this. So while that doctor specifically may not be knowledgeable of it quite yet or not see the value in it, the patient, if you are following your gut instincts and you think that this is something that would be beneficial to you, to be proactive, advocate, speak up, ask questions, and get Octave involved in that communication with them.
Fabulous. Thank you for that. I have a brand new question for you all, okay? What
As
is
a-
the oldest a patient can be to be tested?
There's no age limit.
No age limit.
Okay. And is there any reason to test someone who is years past any B or T cell depleting medications?
Any reason to not test if they're a number of years beyond being on B or T cell therapies?
Right.
Mm-mm.
There's no reason not to test.
No reason not to.
Okay.
We've seen patients tested 2 and 3, 4 years after end of, or stopping disease modifying therapies, and some have come back with low levels and some have come back with high levels. Some have come back with high levels only to have a clinical relapse within, a month or two of having that blood drawn, even though they've been off therapy and stable for 2 years.
Okay. So last night I interviewed a gentleman who stopped using therapies because he was told that his using proper nutrition, this is by his MS doctor, his using proper nutrition and exercise will keep him from getting worse. And no matter how often, I didn't want to badger him, when we were online, but I did speak to him today, and I said to him, you need to get onto something. But if he had this available to him, this testing, if it was available to where he's located, then maybe that would, cause him to say, yes, I need to get back onto therapy. So we said that it's not available to other countries, but is it available to the territories of the United States that are not states?
Like Hawaii, like Puerto Rico?
Like Puerto Rico?
Puerto Rico, like the Bahamas, like Guam.
It is currently not in the territories, but in the 50 United States. That's where we're currently located.
So it's not available in Puerto Rico either.
Is the question specifically coming from Puerto Rico, or I'm curious?
Coming from me about a person that's in the Bahamas.
Oh, they're in the Bahamas.
A lot of your questions are from me, all right?
Some of these are marketing questions, like it's available in Hawaii, but is it able to be drawn on every island?
Stuart, we're gonna put that one on the marketing question list to get back with you.
Thank you for that. All right, let me just skim through these real quick to see if there's anything else new out there. Is it available everywhere? Does a provider have to send the sample to a specific lab?
Yeah. The labs are all processed in Octave's lab. We process the sample. So all the clinic or lab company has to do is just draw the tube, and it comes in a kit, and they put the tube in the kit, and it's labeled, and it just gets shipped.
Okay, thank you for that. Are there any uses for biomarker testing other than just MS? Can it be used for cancer, inflammatory, or even diabetes?
This test was designed specifically for multiple sclerosis.
Biomarker testing. Yeah, biomarker testing is huge in other disease states, particularly in cancer, but not this test.
Yep, right.
Yeah.
Okay, thank you. And a person writes, what should I do if we ask our neuro about wanting to get the test done, but the neurologist does not agree?
Advocate for yourself, Brittany.
Thank you. I was like,
Call Brittany. Just call Brittany. Yeah.
Absolutely. Advocate, speak up. I know that's a very unnerving communication and narrative to have with your physician, because again, as the patient, we're sort of programmed to say, well, my doctor knows, I'm just going to listen to the doctor and I can't ask these questions. Absolutely. You are the CEO of your hot disaster. Ask the questions, go in with a list of questions. If you feel strongly about it, advocate. If you need to get some liaison from Octave to, assist in the communication with your neurologist assistant, possibly advocate for that as well. I wholeheartedly don't believe in taking no for an answer with something that is relevant to, overseeing the care management of our disease. So speak up, and sing out, Louise.
Yeah, and might I add, if there's a nurse or an NP or a PA in that practice, that talking to them, you know, might be more influential than if you get a no from the doc.
Yeah, do not underestimate the influence you have as a patient and use it. Thank you, Brittany.
Thank you. I got 2 more questions and then we're going to be done because some of the people that I'm speaking to here look like they're getting tired. Okay. Does activity often change? Yeah, a little bit. I got you. Does activity often change when treatment has not changed? Does activity often change when treatment has not changed?
Let's just say it's possible. Yeah, because, you know, people break through their treatments.
Mm-hmm.
Okay, thank you. And before I read the last question, Brittany, somebody wrote in, will you go with me to my next appointment?
You know, and that's a funny question. And I have been on personal FaceTimes or Zoom calls minutes before people walk into an appointment. And it's something that I am extremely passionate about doing. I love connecting. Also, if anyone wants to, if you go to octavems.com, there's a 411 tab that I do keep updated and accurate of new technology, new testing that's available. So that's a great resource to go to as well. If anybody does need that extra chutzpah, that extra oomph of encouragement to have that narrative with your physician, please reach out. I'm always happy to connect.
Great, thank you for that. All right, I'm only going to ask this one last question. It's getting late here for everybody, right? For those of us who are lucky enough to have taken the test and have specific questions about individual biomarkers in the second page of the report, who at Octave can answer the questions that our doctor cannot?
We have a team of MSLs, medical science liaisons, that are dedicated to helping answer those questions with the providers, with patients.
And how do they reach those people?
I would go through the website. Again, there's a pretty easy to get in touch, and you just leave a message in your email and we can redirect out.
Okay, great. Thank you for that. So I want to thank you all again. I want to thank Octave for helping to put this together. And we're going to say goodnight. Adios. Bye-bye.
Thanks, everybody.
Thank you, everyone.
Thank you.
All right.